At my first Elite Academy. This is really impressive. I'm excited to share with you my experience with True Science. As you know, I am a dermatologist, and I've been in practice for over 12 years. My practice in Denver includes both general and cosmetic dermatology. I think this is a very interesting or exciting time to be in this field with all the recent advances in science and technology. As part of my cosmetic practice, I perform multiple procedures including Botox, fillers such as Juvederm and Restylane, lasers, peels, sclerotherapy, and more. I treat all ages and a variety of skin diseases. But regardless of what my patients initially come in for, I have found that most of them, both men and women, ask me what they can do to make themselves look younger, look better, look less tired, look healthier. As you know, this is a huge industry. According to the USA Today, baby boomers make up approximately 26.1% of the population, or an estimated 78 million people. Baby boomers may be well into their 50s and 60s, but that doesn't mean they want to look like it. According to the American Academy of Cosmetic Surgery, anti-aging procedures are on the rise. To quote the American Academy of Cosmetic Surgery President, Dr. Mark Berman, the baby boomers are getting older, but they still feel young and want to look that way too. And between 2008 and 2009, facelifts increased by 44%. Blepharoplasty or eyelid surgery increased by 42%. And non-invasive procedures increased dramatically. Botox by 157%. Fillers by 245%. Dr. Berman says that he thinks this may come as a surprise to the public when they see just how many baby boomers are trying to slow down the aging process. Everyone wants to look their best. Skincare products are an important part of my practice, and I'm excited about the potential that I see in True Science. I would like to start out talking about some of the more common skin conditions that I see and where I think that True Science could potentially help. I'm not endorsing treating these conditions with True Science. It's not a medication, but pointing out the range of possibilities based on the powerful combination of ingredients in True Science. Psoriasis, many of you may be familiar with this. It presents as red, scaly, thickened lesions, or what we call plaques, that can be present anywhere on the body, on the face, on the scalp, on the arms, on the legs, on the trunk. It is due to an accelerated rate of cell growth. It affects approximately 2% of the population, or 7.7 million people. It can be a nuisance, it can be embarrassing, and it can even be debilitating. Here, as an anti-inflammatory agent, True Science may be able to help. Another one that I don't have a slide on because I just saw this patient yesterday in my office, and a man in his early 40s came in with severe seborrheic dermatitis. That's also very common. It's like a dandruff-like condition on the face. He had redness and waxy scale on the sides of his nose and his eyebrows, and it had even extended onto the side of his cheeks in the beard area. And he's battled this for years. He had white flakes on his black sweater, and I saw him last year and he looked worse this year. He said that his colleagues at work this last week had asked him if he was stressed out because his skin looked so bad. Over the years, he's seen many different doctors. He's tried many different things. He uses steroid creams on his face, and they help for a while, but it's not good for your skin to use steroids for a prolonged period of time. He's desperate. He said, "Dr. Stone, I will try anything." And I suggested that he try True Science. I explained that it's an anti-aging cream, but that its anti-inflammatory effects may help with seborrheic dermatitis. He was excited about the anti-aging aspect and hopeful that he'll see improvement in his seborrheic dermatitis. I am anxious to see his response when he follows up with me in 2 weeks, and I'll have to let you know at the next Elite Academy. Eczema, this is also very common. I'm sure many of you are familiar with it. I see a lot of this in Colorado. It presents as red or erythematous, itchy areas anywhere on the body, once again, and it can look different. It can look like little pinpoint areas or more extensive in this patient. It's a chronic condition. The mainstay treatment, once again, is corticosteroids. But as I said, that's not good for the skin for prolonged use. Here again, true science may be able to help. Acne, we're all familiar with this, and probably all of us have experienced this at some time or another. I treat a lot of adults with acne, probably as many as teenagers. A lot of women in their 30s and 40s and 50s come in with acne. And often we have to treat it with oral antibiotics, not only for the antibacterial effect, but also for an anti-inflammatory effect. So here again, true science may be able to help, and I've seen that in my office. Rosacea is also fairly common. It presents as red areas on the face, on the forehead, cheeks, nose, and chin. You can see in these patients where it's quite prominent. Another chronic condition, not a great treatment. It's usually due to little broken blood vessels close to the surface of the skin. It's often hereditary. Sometimes we even use oral antibiotics for this when it's bad enough for the anti-inflammatory effect. I have seen true science help with this in my office. Now a really important one that I see a lot of, skin cancer. It's on the rise. It's well known. It's a well-known fact that sun exposure contributes to the development of skin cancer. UV light penetrates the skin and creates free radicals. These free radicals then cause skin cancer by altering the genetic material, the DNA and the RNA of the cell. And skin cancer can develop over a lifetime. The most common skin cancer, basal cell carcinoma. I'm sure that some of you in this audience have had basal cell. It can present several different ways. I know the second picture is a little worrisome. Usually it's like a reddish kind of glistening nodule or bump like you see on the cheek there. But it can be more extensive and be red and scaly and crusted like this second patient. Fortunately, it doesn't spread and metastasize, but it can, if you let it go, it can grow like on this patient, and then it's very difficult to treat. These are treated surgically, can be disfiguring. The second most common skin cancer, and by the way, skin cancers are the most common cancer. Second most common skin cancer is squamous cell carcinoma. It often looks similar to basal cell, sometimes a little worse. It can spread and metastasize, but it's not like the big one that we all worry about, melanoma. This is the type of skin cancer that we all want to avoid. This one is a fairly obvious example. They're not all this obvious. It's a well-known fact that antioxidants quench the free radicals produced by the sun that may help to reduce the risk of skin cancer. And finally, photo damage. We are all susceptible to this skin condition. Notice the freckling and sunspots on her face and chest. Solar lentigos, or freckles, are the most common pigmentary changes seen as a result of sun damage. A freckle develops when the melanocytes, which are the pigment or melanin-producing cells, are damaged and become bigger. No one is immune to aging, not even Angelina Jolie. Hopefully she'll age a little better than this picture, though. Free radical damage induced by UV radiation causes wrinkles by activating enzymes that break down collagen. Exposure to UV light, UVA or UVB, is responsible for 90% of the symptoms of premature aging. It is believed that the amount of sun exposure before the age of 20 is an important risk factor for melanoma. Sunlight has a profound effect on the skin. We've seen examples of this with skin cancer and premature aging. So is all hope lost? We can't go back and turn back time. There are a lot of products out there that purport to treat photo damage and aging. So what makes True Science different? What makes it unique? Well, just earlier this week, my husband was at the grocery store, and as he passed by the skincare aisle, he stopped and took this picture. It's on his BlackBerry, so it's not very good resolution. But he thought of me and knew that I was speaking about True Science this week. And he said, the caption when he sent the picture to me was, "No wonder people get confused. Look how many there are." It's just like these signs above it. How do you know what to choose? Which way to go? Whether consumers are at the grocery store, or at a spa, or online, or even at a doctor's office, it's hard to know what to use.